Hello, everyone. Very warm welcome to today's session. My name is Sanju Soman. I'm a co-founder and CEO of SUSTERA Foundation, and really happy to see you all here. Today, we have a very intriguing discussion on antimicrobial resistance. So, a subject that is nascent, and not many discussions have happened. In fact, when we put the posters out as well, a lot of questions were on what is AMR and why is it relevant. And people were thinking, what is the relevance of SUSTERA doing such a event? And today we'll look into the details of it. So just to give you a heads up on what SUSTERA Foundation is, we are a non-profit research plus capacity building organization based out of Kerala in India, primarily focusing on capacity building for climate action. Over the last 7 to 8 years, we have been working alongside communities, local government institutions, state governments, etc., in building a climate resilient India. As part of it, uh, occasionally we do host uh, uh, events, such webinars, and a lot of other programs that we do. Some of our major areas of focus is one, energy. Similarly, we also work extensively on aspects of farming, agriculture, etc., research related to the same. Marine litter is an important area of focus as well. Uh, uh, for the past couple of years, a lot of engaging discussions are happening on in our circle of climate leaders whom we train as well. There are so many discussions happening on what are the future threats, and AMR is discussed as one of the larger threats that the world is going to face. So then, uh, to understand this, we have brought together two amazing experts. One is Sreelakshmi. She's a doctoral researcher at the Newcastle University. And over the last 2 years, she has been extensively researching on AMR, which she'll be explaining in detail. Similarly, we have Sachin Sathyarajan, a close friend and international law and policy expert who has been working on health-related policy, and is also a professor at and has taught at various universities. So welcome to all the audience and a big warm welcome to Sreelakshmi and Sachin who has joined us today. To kickstart with, I remember having conversations with Sreelakshmi while in the UK about AMR, and she was telling me about her research. I mean, wherever I meet colleagues who work on research, so I would try to understand what exactly they are doing. And this was quite new to me. And she was trying to explain about how we are growing resistance to antibiotics. And when the word antibiotics come into our mind, the first thing is for me is about a doctor during my childhood days telling me and my dad that if you continue eating antibiotics at this rate, you won't be there for long. Because I used to fall sick very often, and then the doctor would prescribe antibiotic, and uh, and I would eat a lot of antibiotics. And nowadays, it has become so common that even without prescription, most of the Indian families just consume antibiotics. It is very common practice these days. And when Sreelakshmi was trying to explain to me that how big a threat this could be, and how more about antimicrobial resistance and antibiotic resistance, uh, we discussed in detail, and that's how now we're having this conversation here. So thanks to everyone who joined. And the first question today we have is for Sreelakshmi. Can you explain what is antimicrobial resistance?
Hi, thank you for the warm introduction and welcome everyone. So I'd like to start with explaining what is antimicrobial resistance. So antibiotics is just one type of antimicrobial. There are others like antifungal. For example, antibiotic works against bacteria, antifungal works against fungus and antiseptics, and there are different other antimicrobials there. So when a pathogen or when an organism develops a resistance towards this and it cannot be killed because of that medicine or that chemical, that's when the resistance is developing inside that organism. So it's like an intrinsic resistance. I would say like survival of the fittest, where it was getting killed before, but it has slowly learned to like get resistant to it and stop the mechanism of the antibiotic work on it, so that it's either it's affecting its growth, it's affecting its reproduction. So these things are reduced. Now, why antibiotic resistance has gained popularity now is, that COVID is the last pandemic. The next pandemic is considered to be antibiotic resistance, because it's believed that around 10 million deaths would happen by 2050 per year because of different infections, and antibiotics will not work properly. Now, this is because the discovery of new antibiotics is very less. So the antibiotics which are already there are already resistant, and most of the bacteria are not getting killed because of it. If I give you like an idea of how much the number of deaths happening right now, the WHO has estimated around 1.3 million deaths per year, which is because of because an antibiotic is not working or an antimicrobial is not working. So that's how serious it is, and how important it is for us to like talk about it or deal with it quickly, so that we can avoid the next pandemic. You know how the last pandemic brought all of us to a standstill. This could be much worse.
Thank you, Sreelakshmi, for that. So, is it right if I would say Dettol can't claim that it would kill 99% germs in like 10 or 15 years?
I'm not
in a language.
I'm not someone to comment on a particular brand, but still, I would say that, for example, how an antibiotic works is if a microorganism is present in our body, if we take like a course of antibiotic, it's going to either kill the bacteria then and there, or it's going to affect one of the mechanisms, like how we are taking food. It's going to produce protein in its body. It could affect the mechanism with which the bacteria is producing a protein, so it cannot survive, or it interferes its reproduction. So maybe it will not be able to produce more resistant bacteria. But when the antibiotics stop working, these mechanisms are not working on the bacteria. So let's say there are 100 microorganisms which I have in my body when I'm taking a course, and I stop the course after 7 days when I have to actually take it for 15 days. That one bacteria which is remaining in my body is becoming resistant. That microorganism is going to reproduce like in millions. They're all going to be resistant. So yes, it's not ideal that if you take an antibiotic, everything is going to get killed. But it's good to always finish the course. It's always good to like use Dettol, because that's definitely going to avoid it. It's not like 100%. It's not 100%.
All right. Thank you, Sreelakshmi. Could you also put some light on your research that you do at Newcastle University? I know that you told us about going to water bodies and testing the water quality, and also testing the bacteria in the water and much more. Could you explain a bit, for all of us to understand the very basics of what your research is about and why it's important?
Yeah. So generally how culturing happens is you take like blood or urine from the patient, and then you culture to get the microorganism. But this is a different approach where you use wastewater from a particular community or a hospital, and we analyze the wastewater to see how many microorganisms are present, how resistant are they, how many resistant genes are present in the wastewater. So this is what is called wastewater-based epidemiology. So it became popular during COVID. Many people started understanding that wastewater can also be used to understand how many people have COVID in a particular community, rather than individually going and testing each patient. This was popular since a very long time, but it was there since a very long time, but it didn't get that popular. It was used to like find drugs in the wastewater, to find, let's say you can't understand how many people are taking drugs in a country. So in US, they started using wastewater, because when you secrete, the drugs are going to get into the wastewater. So what I'm trying to do is I'm using wastewater to analyze antimicrobial resistant genes, to see if I'm trying to say the difference between a hospital, between a community, and even between hospitals, to see how resistance is varying, so that there could be a regulation on how much antibiotics can be prescribed from that particular hospital, or should you reduce or increase the use of antibiotics in that particular hospital. So it's basically using wastewater to try to find out how resistance is varying.
And the primary sources of the antibiotic entering the water bodies are?
So the primary source mainly it's through wastewater is because of patients, it could be because of cattle. So cattle, we do not generally talk about it, we just talk about antibiotics which we consume, but the main reason or main cause of resistance being spread so much is because of cattle, because the amount of antibiotics consumed by cattle is 10 to 20 times more than what we are consuming. And mostly our cattle are given antibiotics even when it's not required, where even if they don't have any infections, they're just given so that they can be healthy, and it's like a business tactic so that they are healthy when you give it to the consumer. So when we excrete, there's resistance which is going into the wastewater, and that can spread even through plants where fertilizers, different chemicals are being used. These are all antimicrobials being given to different living organisms. So these secreting excretions, all this can go into the wastewater, and there's how resistance is getting into the wastewater, and that's what I'm testing.
Okay, thank you, Sreelakshmi, for that. Now, moving on to Sachin. Considering that this is a very important issue, what are some of the international efforts or agreements that exist to address this challenge, and how effective have they been in curbing them?
Yeah, so I think Sreelakshmi had mentioned the science part of it. So, as she pointed out, this I think WHO has classified this as AMR as one of the top 10 uh, public health challenges which we are going to face. But when we saw COVID-19 and how it played out when it comes to vaccines and the kind of solidarity that was needed internationally, it was lacking. So there was definitely an access problem, right? So even though we understand the science behind it, there are behavioral, political, economic, and even environmental factors in deciding how we tackle AMR as an international community. So why should we approach this from a global point of view? I think there are two reasons. So one, there could be like that has to come for like the new sort of diseases which are creating, right? So there should be an increased supply, and there's also another part where for existing antimicrobials that are available, there should be a steps for improving stewardship. So that requires countries to play together. And this is why I think SUSTERA is also a good platform to discuss AMR, because much like climate change, there is a tragedy of commons issue when it comes to AMR. So local solutions are seen as shortcuts, like at a local level, increasing, doctors can prescribe more and more antimicrobials without considering the long-term effects of their prescriptions. But what we are essentially creating is a global problem. And at a local level, unless there is responsibility going down to the local stakeholders, it is difficult to address this issue, right? In one aspect of this is that there is sort of an intergenerational justice, because the future generations might not be able to deal with diseases as we have. So like we are compromising the potential of the future generations. At the same time, there's also an intergenerational justice issue, because as much as European Union's new directive is looking at overuse of antimicrobials, there are so many countries, a lot of the low and middle income countries, the LMICs, which have an issue of underuse of antimicrobials, and both are contributing to a tragedy of commons when it comes to AMR, right? So here you have the global commons, which is in operation, where we'll need access to these AMR to tackle some of these pressing health challenges. Second is a collective action problem at an international level. So there is no big brother. Like now that we have seen that even with COVID-19, what we have seen is a lot of the international actors are much more passive, because in international law, there is nobody who is going to come with a stick and make sure that independent sovereign nations will take steps to tackle these challenges. So there is a collective action problem in international relations, and this is something that we've seen in environmental issues also, right? So, so these are probably one of the major issues when it comes to tackling AMR at an international level. And obviously, there are side issues like an oversight mechanism is absent at an international level, even though WHO has come up with a lot of soft governance measures. Second is there are institutional consequences because the high-income countries should be able to come forward and say that they're going to share the burden because LMICs, the lower and middle-income countries, might not have the resources to tackle AMR at a country level. So there is definitely a burden sharing which is required at an international level also. So I just wanted to start off with the major challenges when it comes to international law addressing something like AMR. However, in 2015, the Global Action Plan was released by the World Health Organization, and it definitely came up with measures so that member states come up with national action plans. Initially, there were only few countries which were warming up to it. But by 2021, almost like 150 countries have already come up with their national action plans. So even though there are no binding treaties so far, so there is no treaties with sanctions which are created at an international level, soft governance initiatives like that of the Global Action Plan have been created so far. And so the interesting part of this is that states are, even if a treaty comes on AMR, and that is what I think the European Union has been pushing for so far, to see to it that there are AMR provisions within the pandemic agreement framework. See, that's unlikely because states always cater to the domestic stakeholders, right? The pharmaceutical companies and the corporate lobbies within their states. So chances of states agreeing something in a formal treaty is much less. And I think that is why organizations such as the WHO has joined forces with Food and Agricultural Organization and WOAH, the World Organization for Animal Health. So they've created a tripartite partnership where they have come up with a One Health approach to handle AMR. So I think that is also one of the major initiatives, like a trilateral partnership, that has come forward to address the issue of AMR globally.
Okay. So, Sachin, considering that India is being stuck with problems one after the other, climate change itself being a major threat that the country is facing and its population is going to face, and now from your conversations, it's clear that AMR also, from both of your conversations, clear that AMR also could be a threat that our massive population is going to face. So, what are the steps that the Indian government is taking in this regard?
Okay. Like the WHO had already published like medically important antimicrobials last year. I think Sreelakshmi will be better positioned to get into the details of it. But then there is something called the WHO aware framework where they have looked at classified some of the antimicrobials on an access level, like amoxicillin, where it has to be continuously be available for use in human beings, and then some of them have been batched as watch and reserve categories also. So continuously there are communications coming from international organizations on what kind of steps that national governments can take. So again, going back to my earlier point, there is a global action plan which was created by WHO in 2015, right? And in 2016, the General Assembly also came up with a political declaration in that effect. So following those lines, the Indian government came up with our national action plan in 2017. So in India, I think, if I'm not wrong, has the highest use of antimicrobials in the world. And it is also, India and Bangladesh are also touted as one of the largest producers of affordable antimicrobials in the world. Right. So, so keeping all that in mind, the Indian government came up with the National Action Plan. So they basically started with like the foundational steps, like to see to it that there is no over-the-counter prescription of drugs, to stop self-medication, to see to it that there is no incorrect use of antibiotics, some regulatory changes as in like stricter implementation of existing policies, although stop some the unethical commercial practices, not antibiotic use. So all those steps have been addressed by the National Action Plan of 2017, and they have also looked at
Sachin, we've lost you. Yeah, carry on. Now we can see. We can't hear you. Pardon? We can't hear you. Okay. So could you unmute and try once again? No. So I'll come back to Sachin. Meanwhile, moving on now from what Sachin was clearly telling, the problem is also about awareness. And I think in India nowadays you get antibiotic at a very low cost of even 10 or 20 bucks. And people hesitate nowadays when they have a fever to go to a doctor and pay the doctor fee, and rather they would just go and buy antibiotics because it has become so cheap. So there is a lot of intervention that is required in terms of awareness. So, Sreelakshmi, could you put some light on how individuals contribute to combating AMR in their daily lives, especially when it comes to antibiotic use?
Yeah, so I hope I'm audible.
Yes, yes.
Yeah, okay. So the picture of antibiotic resistance is really big. Like at an individual space, you can actually do some things, but at the same time, the resistance doesn't. Now the situation is such that the resistance does not just spread through the individuals, but it has become a bigger picture. But still, we can do our share, which could help us to reduce the antibiotic resistance. So prevention is definitely better than cure. The first thing we can do is to not get an infection so that we don't have to take an antibiotic. So the first thing is hygiene, definitely washing your hands, taking care of everything. I think COVID did really help us to understand how important sanitation was, hygiene was. We understood how virus travels or transfers from one person to the other. So we need to like wash our hands properly, take care of, we shouldn't let it spread to another person even if we have an infection so that the other person needn't take the antibiotic. So cover your face, your nose, your mouth when you're sneezing, coughing, etc. Not throwing disposing your tissues or whatever waste that you have just in the open. So such things could help us to prevent someone from getting a disease. But at the same time, if you have the disease, you have to take an antibiotic. There's no other way out. But always go through a doctor. The doctor should, let's say, prescribes for like 10 days. Even if your symptoms reduce, most people, like especially in countries like India, most of the people stop taking the antibiotic after their symptoms have reduced. But try to stick to the whole course, because there might be that one microorganism which could like get resistant just because you forgot to take it on the last day. And that could spread to millions and millions of bacteria and then spread to a lot of people. So when you take the medicine, take it for the full course, and definitely avoid buying any medicine over the counter. So one very big misconception is if you are sick, it is because of a bacteria and you have to take an antibiotic. But virus is something which causes a lot of infections, and antibiotics do not work on virus. So that's something which people do not understand. They just take antibiotic considering that they have an infection. So only bacteria is affected by an antibiotic. So if you have an issue, if you have an infection, show to a doctor, and then if they prescribe, only then take an antibiotic. So this is generally what individual basis you can do. But again, it's a bigger picture, because now it's not just about transferring resistance from me to you, but it's about a lot of other factors. Like even if I never have taken antibiotic in my life, I still get resistance through my food and water. So another thing which is we can do is we have to be aware about it, and help for such causes, like organizations like yours, like SUSTERA, and other organizations who are like working towards all this. Or there are different, like for example, the research that I'm doing, I'm trying to get treatment plants to like improve their treatment, so that the wastewater does not like the wastewater which gets into the river after treatment does not have the resistant bacteria getting into a river. So like people like me, if someone can support us, that is a big thing to actually reduce resistance, rather than just taking care of our antibiotic use. So it's a big picture, but definitely these are some things which you can take care when, as individuals, we can take care of as individuals to reduce the resistance.
Right. And as a researcher, what are some of the breakthroughs that we have achieved? And also, what do you think are some of the research that is pending and that we should immediately do? For example, you're telling me how even water filtration system that we normally have can't really block the bacteria. So what are some breakthroughs that we really need?
So what research has happened so far is the antibiotic resistance did not just come up like today. It was there. So for example, the supervisor, my professor, whom I'm working, he has been working in this field for like 25 years. So resistance didn't start today. There's been a lot of research. But the thing is, there's a huge gap between research and what initiatives government or other organizations take. Because what people understand, what researchers understand, and what a medical practitioner understands, and what a government understands are completely different. There's still a gap there. But still, there's a lot of research that has been done. For example, how a bacteria is gaining this resistance has been studied, and that mechanism, even though it's like the tip of the iceberg that we still don't know how the resistance is acquired by it in many different forms, but at least we know a tip of it. So we still know, like, okay, if we discover a new set of antibiotics which can bypass that mechanism, maybe we can kill more microorganisms. So that understanding how the bacteria is gaining that resistance is some research which is happening right now, which is really helpful. New discovery of antibiotics is very slow, but still happening. So that's a good thing which is happening, where in future, maybe the pandemic can be avoided if we find a very good antibiotic group. Now, one thing which I forgot to mention is multi-drug resistance. So there are bacteria who are resistant to multiple drugs. So that's something which again came out was a breakthrough in research, because everyone thought it was just one antibiotic that one microorganism is related to, but now there's multi-drug resistant groups there where they're resistant to like 10 or 100 antibiotics. So those are different breakthroughs which has happened so far. But now I would say that coming up with new antibiotics is definitely the breakthrough that we need. Especially for like the lethal, like the infections which can cause death for sure, which are antibiotics which are given to like deathbed patients. Those categories have already become resistant, many of them. So we need those new antibiotics to be discovered, which can help in reducing the deaths caused by different bacteria and microorganisms. Also, like I was saying about treatment plants, we need to come up with new treatment plants. So there are different research happening on treatment works, where the new technologies which can avoid the resistance getting into water after treatment, which is not really the case. Like I'm working in the UK, and even here it's not actually adapted in many places. So the resistance, the wastewater that I'm using, the water that I'm testing is after a treatment. So it's just the water which is going to a river where you drink, or an animal drinks, a plant takes in. So the resistance is getting in. So treatment works. Such discoveries are good. So these are the breakthroughs which are required actually, and research is still going on. And what I am trying to do is I'm trying to find different parameters like pH, oxygen demand, temperature. I'm trying to correlate these with resistance, so that quantifying resistance is very costly. Very, very costly to like find genes in it, find resistance. But if I can correlate them to pH, temperature, it's easier and cheaper. So this is another research which is required, so that the government can regularly monitor resistance getting into the river, getting into human beings, getting into cattle or other animals. So,
all right. Thank you, Sreelakshmi. So moving on to Sachin, I would like you to finish what you were telling, and also shed some light on Kerala, because I was reading today that Kerala was one of the first states to have a policy, an action plan on the same.
Yeah, so just completing what I was talking about, the National Action Plan, which has come in India. So I think one of the first steps is basically educating the masses on what is antimicrobial resistance. So compared, if we compare ourselves, our position with the EU and all, so European Union is trying to basically push, as I earlier mentioned, into pandemic agreement, create best practices and all that. But I think for countries like India, I think the first step is to start with awareness. So they are creating training programs for the medical professionals, training courses. They are also trying to see if behavioral changes can be included with already existing programs like Swachh Bharat Abhiyan or the TB education scheme, etc. And at the second level, we are looking at surveillance, right? So using the existing infrastructure in India, like the labs, where to see to it that there is proper AMR surveillance. Third is with respect to creating standards for optimum use. So a lot of emphasis has been done by the ICMR study in 2017, where they are creating standards for optimum use of antimicrobials. And even when it comes to R&D and things like that, there is a fear that there won't be much investment in antimicrobials because the returns from creating an antimicrobial might not be good enough if the microbes develop resistance. So to push for increased R&D within the domestic pharma sector, I think that's also a major step for India, considering India and Bangladesh are still one of the major pharmaceutical producers for the global south. So I think that is the framework that India has been aiming for. The implementation has been very slow, and there's been a lot of criticism regarding that. But Kerala has become like one of the first states which has started with the implementation. So we had our state action plan in 2018. So now when we go to any medical shop, I don't know if you have noticed it, there is a poster saying that antibiotics will not be given as long as there is no prescription from a doctor, right? So, and they have started with the Amrit, Operation Amrit, where there has been a lot of raids on medical shops to see to it that over-the-counter sale of antibiotics is stopped. And there is also like a toll-free number which has been circulated so that the public can report medical shops which are not following the policy, right? And there has also been an antibiotic literary campaign in Kerala, so that at block level there is awareness on what is AMR. And there has been another scheme which is called PROUD, which I think is interesting because it's a drug take back scheme that has also been started in the state. So there has been a lot of developments that Kerala has been pioneering, and as usual, taking very progressive measures in public health.
Thank you, Sachin. I was quickly thinking when Sachin was mentioning about drug take-back scheme. If a lot of expired antibiotics end up in landfills and they would leach to the ground, that is going to cause a major trouble. So, Sreelakshmi, could you tell us some connection? Is there a connection with AMR and climate change? Because I mean, when one connection that I could establish now is about the waste management and how water could be impacted with the expired antibiotics. Another one is that, I mean, during the 2018 floods, a lot of families living in wetland regions were impacted by various diseases, and this exacerbates the number of patients who need antibiotics. That can make it a double-edged sword. So, could you shed some light on its connection with climate change and how these add to each other?
Yes, you're absolutely right. Climate change can definitely have an impact on resistance because yes, infections are going to increase when a pandemic happens, or when when a climate, because of climate change, if there is some event that's happening, there's some calamity that's happening, that is definitely going to increase the infection spreading. Waterborne diseases are going to definitely increase because of that, which is going to indirectly increase the use of antibiotics. It's going to as a in the wastewater, the resistance can also be transferred from a bacteria to the other through the wastewater, especially when there's a waterborne disease, or let's say there's a flood happening, that can spread the resistance way faster to different areas. And that actually is the direct link between climate change and antibiotic resistance. So the usage is going to increase, and that's definitely going to increase the resistance. But as a researcher, I have to talk about if the antibiotic resistance in a bacteria can increase because of climate change. Now, there's no conclusive study as such showing the direct correlation between a bacteria's resistance increasing because of the temperature increase or a climate change. So like I was mentioning earlier, one of the steps of my research is to correlate between pH, temperature, the resistance correlated between pH, temperature, or other parameters. So I've not found a conclusive way in which I can prove that, okay, when temperature increases, the bacteria is able to get more resistance. But there are studies which are still going on, and we require much more extensive studies or research on it to prove that resistance increases. But overall, yes, you're right, like calamities or different forms of climate change can actually increase antibiotic usage and increase the resistance in turn.
Thank you, Sreelakshmi, for that. And the final question for the panelists that's for Sachin. So, considering that this is an important issue that we need to address, what strategies do you think can policymakers adopt, starting from the local level to a national level, to balance the need for antibiotics while also minimizing the risk of AMR?
Yeah, so I think I gave an overview when it comes to the international, national, and state level measures that has already been taken. So at the national level, there is still a push to include AMR within the pandemic treaty framework, and to also sort of recognize it as the next big impending public health issue. I think there was also a proposal to declare AMR as a public health concern, and to see to it that there are already measures in place. So from 1945, I think there has already been talk about AMR being like a global threat. So at the international level, I don't see anything which is going beyond the soft law, where there is governance when it comes to giving clear directives for the states to come up with action plans. And I think the Kerala model has been quite interesting to study, where there has already been measures being taken so that there is more accountability when it comes to use of antimicrobials.
Thank you, Sachin. One of the first steps I think all of us here should take is to create this kind of awareness about one, overly consumption of antibiotics. Because nowadays, at the local level, even among friends and family, we commonly see overconsumption of antibiotics. I think that kind of awareness building and talking about this issue itself is one major step that we should take. So with that note, I would open it to the floor to take some questions. So if you have any questions, please feel free to unmute and ask. Or you can post it as questions here. Anyone?
Hi, can you hear me?
Yes, audible.
Okay. This is Mohammed, and I have like very basic doubt. Actually, it is like this antimicrobial resistance and this kind of thing. We are like hearing in very recent days, like after having discovery of drugs, vaccines, everything. But if you see like some diseases like smallpox, chickenpox, that will develop natural immunity. When microbes can develop that resistance to drugs, why human body is like not developing any resistance to microbes. That's what I would like to know actually. So just clarify this.
Sreelakshmi, do you want to take that question? If you
Uh, I would say doctor should be the right person to answer this, but a bacteria is a very tiny organism, like a single cell structure. So we are like a complex organism. It's not that easy for, we do like acquire resistance to different things. So we hear people saying that, okay, this person gets disease very quickly, but the other person doesn't because our resistance is different. So that's definitely there, but it's not that easy for us to like acquire resistance to all the organisms. So what we need to understand is it's not the exact same bacteria that's going to affect you the next time. It's going to be a different form of that bacteria that's going to affect you. So you might not be like resistant to it. But when we take an antibiotic, it's the same chemical, same mechanism that's going to affect it. So technically, I would say that's the reason why it's easier for a bacteria to like gain resistance. And it's not like on a like in one day that we gain that resistance. It's like the bacteria gained that resistance. It took it like so a long duration for it to like gain that resistance. So because it's a tiny, it's like a microscopic organism.
thank you, Sreelakshmi. We'll just take one more question. If anyone wants to unmute and speak.
Good evening, everyone.
Good evening.
I'm Surya Narayan, and I'm an environmental engineering professional. Hi, Sreelakshmi Shetty. So I'm curious about the potential challenges that bacteria having AMR genes might pose in wastewater treatment systems. Also, considering the present treatment technologies in India, it's either possibly MBR or MBBR system, and the tertiary treatment unit system is PCF, PSF, ACF, or UV, or these units combined. And this UV system can possibly eradicate almost every sort of bacteria. So up to what extent, what do you think, like these UV units deal with the bacteria having AMR genes?
Okay, so to answer your first question, wastewater treatments have a big role in it because, like I was saying, one of my colleagues who's doing a research it's on river water. So it's just directly after a treatment work when the wastewater gets into a river, she has tested the resistance and the resistance is really high. Now, the thing is, it's not about killing that microorganism. It's not about killing that bacteria. Like you're right, UV kills bacteria, but the resistant genes can remain in the wastewater and it can be transferred to another bacteria. It does not require a live bacteria to be on it to transfer that. Resistant genes can move through the wastewater and transfer to another microorganism. That's why it's this serious, because it's not like a live bacteria goes and gets into our body and then the bacteria acts on the resistance, but it's that it can transfer it not just through reproduction, but also through, it's called horizontal gene transfer. So it can transfer to another microorganism and the microorganism need not be live for it. So that's why even if the treatment works like 100% on killing the bacteria, it need not be 100% efficient in dealing with the resistant genes which are present in the wastewater. So there are treatments which are currently there's research happening, especially in India. I've seen like advanced treatment methods which can actually stop the resistant genes from transferring, which is great, but they're very costly. Especially like countries in India, they cannot be like a fully fledged treatment method used in a big treatment plant. So still research is being done on it. Let's hope that there's a cost-effective treatment which can be used in a large scale, be developed very soon so that at least through wastewater, it's not being transferred.
Thank you, Cheshi.
Thank
So
you.
much.
Thank you, Sreelakshmi. Sachin, there's a question for you. Is antimicrobial resistance a result of policy failure? Because we promoted generic medicines in India.
Yeah, so responding to Avinash's question, so the generic drug industry basically created affordable medications. So as opposed to patented medicines, the push for generic drugs industry, which was a result of India's progressive patent laws, created more access to affordable medication. The only link I can see between generic drugs and AMR is that maybe antibiotics became more affordable. But at the end of the day, it's the indiscriminate use which may have contributed to it. So in India, I think a lot of self-medication, over-the-counter giveaways of medication probably would have. So I think those kind of challenges would have been an issue. But I think on a much larger level, it is a global problem, and it is something that we are addressing through very, it needs different strategies. And that's why the One Health approach is being mooted, because you have to tackle it not just from the human level, but you have to look at from the plant health, you have to look at from the animal health, and so it has to be seen from a much more comprehensive manner. And I don't think there's a direct correlation between the generics and having AMR as like a global pandemic.
Sachin. So to end the session, Sreelakshmi, could you take this last question from Rakesh to reiterate on the idea of what even we can do? So he was asking, does a person who does not consume antibiotics or does not prefer antibiotics, to that person, a body have less antimicrobial resistance?
So yeah, it's not, it was the case before, but no, now even if I've never had an antibiotic, I'm still going to consume water and food which is being prepared, which has resistance in it. So my team had a small study done in India where they tested food in India from Delhi, and they found that the food had resistance. So which means that even if you don't take an antibiotic, it's so widespread now that it is definitely getting into our body, and we are getting resistant to it even if we have never taken it. I mean, individually, what we can do about it is we can't stop, we can't take food which might not, we can't always go and test if the food has resistance in it. So we can't do that, but it's just about awareness and organizations and government taking an initiative to reduce the resistance, especially it mostly spreads through water. So wastewater treatment plays a big role there. So organizations or government taking an initiative to make treatments better, more research being done on it should help. But individually, yeah, I think we will have resistance in our body.
The Delhi food thing that you did really, I'm sure it scared all of us. So Rakesh, there is no escape from this. But yes, there is hope, because we have together fought the COVID pandemic, such a big of an issue. Within a few years itself, massive funding, massive collaboration was done. And up to an extent, we were able to put it to a stop. So hoping that this is being taken seriously, and that all of us, at least 20 of us who are here, need to talk about it, write about it, and create more awareness. And finally, thanks to all participants who joined. And Sreelakshmi, Sachin, very, very, very happy that you joined and talked to us about this. This is something very serious and scares all of us. So a big thanks for you to joining us today and giving us your thoughts on this. Thanks a lot.
Thanks to Team SUSTERA for organizing it.
Thank you for having me, and it was a pleasure talking about my research, especially to give some awareness through your organization and the great work that you're doing. I mean, kudos for that.
Thank you all.